Alright, so this is going to be your tandem setup. First, you're going to have the aerobic flutter along with the pet therapy device. It's called the VersaTap. The managers at each department, they have the ability to order both of these devices. So to do the tandem therapy, you're going to use both of these devices. You're going to use the mouthpiece off of the PAP, and then the back end off the PAP. And then you're going to have the O2 tubing, and it goes off of the O2 port right here. So on this, you have a number that you can move back and forth. That's kind of resistance in your flutter. It always comes set in the middle. And then the other portion, it goes off the wall. So you can use this on oxygen or air. We typically use it on oxygen. We don't have much air here in our hospital. So again, 5 is what we start out with. Some people can think 5 is a lot, 5 liters off the wall. For me, myself, it doesn't really do much, so you can turn it up. We usually do it in 3 increments or even 10. So like 10 for me is a pretty good workout. So anybody that has decent lungs probably start at like 8 to 10. So I'm not going to blow on that one because that one's going to be for demonstration. I already have one hooked up over here. So same setup, just like I said, it's just hooked up. So we're going to go off the wall. Again, here's 5 liters. The ideal is to get the patient to do 10 breaths, and preferably to do this after your treatment because your airway's a little more open. This helps you get more air in and be able to cough more forcefully and get your secretions out. So again, I'm going to turn this up to 10. You're going to be able to see the difference and hear the difference. 5, you know, I just felt it a little bit in my chest, but whenever I do this, you'll see it kind of helps the lungs really. And doing that 10 times, only done it 2 times, and I could already feel like I was, like, you can feel like the kind of the workout and it actually making your lungs really expand. I really don't know about much more than 10. Probably 10 would probably be the limit, but you potentially could go higher.